So, Dr. Brant, it's really good to meet you and to talk with you and to welcome you to the Men Alive podcast. For those that don't know who I am, I'm Dr. Jed Diamond and do interviews and work in the broad field of men's health. And just I want to read a little bit from what I have of your bio. Dr. Brant is a board certified urologist. His practice is dedicated to men's health with a particular focus on sexual and erectile medicine, specializes in erectile dysfunction, low testosterone, and other men's urological conditions. So, the way I tend to begin with people is to share a little bit about my origin story of kind of how I got started in the men's health field. Really began when I held my newborn son in my hand in November 21st, 1969. And I made a promise to him that I would be a different kind of father than my father was able to be for me, and to do everything I could to create a world where men were fully healed and engaged with their families throughout their lives. So, Dr. Brandt, I just invite you maybe to share a little bit about your own experience of how you got interested in men's health.
Well, thank you so much, and thanks for having me on here. This is a great opportunity, and I'm really looking forward to the rest of our conversation. So, as you mentioned, I'm a urologist. I was doing my residencies first in general surgery, and then urology is the norm, and became sort of slowly more interested in the men's health side of things. I wouldn't say there was a single revelatory moment or anything like that, but it's a really fascinating thing for a variety of reasons that I'm sure we will get into over this hour about how men think about their health and how they pursue their health. I think men's health it has some particular interests in one that it really deals with all ages. It's a an entry point into the healthcare system and sort of the journey and experience of wellness and not wellness, ranging from people teenagers and who have issues to people starting families, all the way, of course, to the oldest of ages. So that's pretty impressive. And another part of it is that men can be quite private. This is something that's evolving over time. I'm sure we'll talk more about this. But the both ability and responsibility of being able to talk to people about their most intimate things, whether those things are shameful or not shameful, is really a privilege and an honor. And it feels great to be able to help people. We have lots and lots of happy patients, and when I compare myself to my peers, I probably get more patients sort of crying, usually with joy, and being very thankful for what we're doing, which is satisfying.
Super. Well, we share, some similar interests. I actually was in medical school before I left. I started UC San Francisco Medical Center. I think you have some
Nice.
ties to San Francisco Bay Area in your earlier years. And I found at the time that medicine felt too restrictive in terms of the kind of areas that I was interested and got into. So I eventually left and went back to school years later after I had gotten a master's degree in social work and went back and got a PhD in international health and did my dissertation on men's health and some of the differences between men's and women's health. So one of my colleagues, I wanted to ask you about. There's a field that's been developing called gender-specific medicine, and one of my colleagues, uh, Marianne Legato, is an MD. You may know her and her work. She wrote a book called Eve's Rib: The New Science of Gender-Specific Medicine. And she said, this is a quote, she said, "Everywhere we look, the two sexes are startlingly and unexpectedly different, not only in their internal function, but in the way they experience illness." So I'm just interested in what you know about the field generally, and as she's articulated it and developed it over the years, and kind of what do you think about this notion? Obviously, urology is not limited to men's health, but it tends to be focused a lot on obviously men's issues. What's your sense of that experience in
Yeah.
gender specific medicine?
I think there's been a lot of exciting stuff, and I do only treat men, but seeing it from the both sides, there's both advantages and huge deficits on both sides. We see that a lot of trials and whether it's medication or other things have really been focused on a certain type of man, sort of the classic, white Northern American, da, da, da. And so it may be oriented toward that. We see that a lot of things in women's medicine has really been neglected, I would say, and is now coming to the forefront. Right now, in the popular news, there's talk about the clitoris sort of finally being mapped. You'd think this would have happened a long time ago, but as recently as the 80s in medical textbooks, it was just described as a little penis. So that's something that's been pretty neglected. Viagra came out in the late 90s. There was no equivalent for women until relatively recently. So there's that disparity. On the flip side, to make a very gross gender stereotype, women know a lot about women. Women talk amongst themselves, and they are more able to share in their experience, whereas men don't know anything about anything. They don't talk, and they feel sometimes, it seems, as though they're the only one who suffers from any given thing, erectile dysfunction, Peyronie's disease, any number of issues, because they never really talk to their peers about it. And in doing so, they can't really avail themselves of help that's available. Um, Additionally, these men, they because of social influences and other things, they don't want to come in. They think of themselves as macho, or they have a certain role that they have in society, and so they may be very reluctant to enter into the healthcare system. And I think that is changing. But so there's some things where men have really had tremendous advantages in terms of the medical system, and some where they've had tremendous disadvantages, and vice versa. I think it's great that more and more attention is being paid. And another thing that we see now is there has been some pushback against some of the previous dogma and maybe even myth that women, for example, should not have hormone replacement therapy. And we know that that's not good for them. There's no reason to withhold it. There's lots of reasons to do it. And there's been more vocal clinicians out there, mainly women, but also men, who have really been clamoring for equal attention to be paid to women's hormonal issues, just as men have paid more attention to testosterone, for example.
Yeah. Well, the field, that has developed in gender-specific medicine, recognizing, the differences beyond just the obvious, differences in sexual equipment and so on. But Dr. Legato, over the years recognized that, and I think you point this out, that there's been a lot of emphasis on women's health, and women are very knowledgeable and very much they talk to each other, they write to each other. There's a lot of focus, and she acknowledged that really the whole men's health over the last 25, 30 years, as I've been doing it, have really been neglected. And she said in one of her books, she said the premature death of men is the most important and neglected health issue of our time. And I'm just interested in your comment about that. That's a pretty strong statement. And as you say, you work primarily with men and along many issues, not necessarily ones that all would be life threatening, but I think they all add up to a great deal of neglect about men, both by the men themselves. If we're not talking to ourselves, if we're not listening to other men, we tend to think it's just me. I got to go it alone. And you are advocating, as do I, that hey, we need to talk, we need to share, we need to learn together.
There's a certain irony that's built into this, because on the one hand, there are men, my father is an example, where they, after he had kids, went to college, he sort of felt like his duty was done, so there was no real reason to pay attention to his health. On the other hand, a lot of men are seem to be victims of their own attempts to better their health. They do go into it alone. So there's many examples of this, but for example, looking at testosterone, one of the many drugs or things where some is good and more is not necessarily better. So in the attempt to make sure they're having good lives and full lives and to retain their vigor and their strength, and they may completely overdose and lead to other medical problems. So they can lead to cardiovascular issues, stroke, and so forth. Um, Another thing we see is like in the supplement industry, which is obviously huge, that people they grab at everything. Men may take 50 different things, all of which overlap, and then suddenly they've completely overdone it. Not because they're stupid or anything like that. They just don't really have a way of evaluating this. There's all this pressure and all this information coming at them, and they're just trying to do the best. Similarly, men are focused maybe on productivity, whether that's in the work or taking care of their families, and that slow grind of stress and going on. And they think, well, but I also need to exercise, and I also need to do this, and I also need to do that. They slowly grind down themselves from both a medical and psychological perspective.
Yeah, I totally agree. I think, as you know, I wrote a book in the 1990s called Male Menopause, and at the time it was I had many clients, women who went through menopause. Menopause continues to be talked about in all kinds of contexts, and but the idea that men might go through something similar was both a revelation to me in the 1990s when I started looking. I knew my wife was starting to go through the change, but I thought, well, that's women's thing. That's what women's do. And I began to learn from starting from my wife that, hey, there are things that you might be going through with hormonal changes as well as you got older. And so I started researching and ended up writing this book called Male Menopause that came out in 1997 and became an international bestseller. It's been translated now into, I think, 17 foreign languages. And obviously, it became something that was of international interest. And we talked a lot in the book about testosterone and other changes that men go through as we age. And maybe you could talk a little bit more about what testosterone is for, I mean, we all have a general idea of what it is, but
Right.
the different ways in which it impacts our health and what are some of the issues when testosterone is too low, and then we can get into some of the misunderstandings and some of the confusions about what do you do about low T or low testosterone.
Yeah, it's such an interesting subject. Obviously, I'm familiar with your book, and I think what people don't recognize is that when we think of women's menopause, there's I'm not saying it's binary, but there is more of a drop off. Whereas with men, it tends to be more of a gradual thing, although there's certain situations in which it can be quite a drop off too. So men sort of slowly are finding themselves more fatigued and more this and more that. But there's a lot of literature at this point which demonstrates to me that having a normal range testosterone is just simply good. It's not good to be low. It's not good to be high. It's good to be normal. And we or men tend to think of testosterone purely in a sexual context, whether it's from libido or for erectile dysfunction. I can come back to that. But I think what they don't remember is that if you look at the pie of what testosterone does, that sexual aspect is a very thin slice of that pie. And really, testosterone is important for everything that makes you a man. I mean, whether it's a cognitive function, your bone health, your muscle health, your cardiovascular health, yes, also the sexual issues, but really everything about your healthiness and your vigor. So one of the myths, I think, is that it is a purely sexual thing. And ironically, if you look at testosterone purely from an erectile point of view, testosterone is a terrible erectile dysfunction drug. You of course do better with a normal testosterone, but in and of itself is not a cure or a treatment for erectile dysfunction. Another myth that's been pervasive has to do with the relationship between testosterone and prostate cancer. And this is really an enduring myth that we still see, despite it being 2026. We get pushback in this all the time. But the reasoning was that in a man who has been treated for prostate cancer, and prostate cancer is incredibly common, one of the most common, not only cancers in men, but killers of men from a cancer point of view, that if you gave a man with a history of prostate cancer testosterone, is like throwing fuel on a fire. We were going to doom them. But that's a terrible analogy. It's much more like watering a plant. You'll never get a tree if you water a plant, if that wasn't a tree to begin with. And if there's no seed in the soil, you won't get anything. And so people have been denied the testosterone, and they go about sort of a potentially miserable existence with low testosterone, even though they could not only benefit from taking it, but they'd benefit from it very safely. So that's another enduring myth. Another myth, I think, is, and this is where there's a lot of, I don't want to say predatory, but it is a bit predatory information that's given to men, that if you just take this or you just take that, it will boost your production. That's probably not a great way to think about it. I mean, testosterone, if you just take testosterone, is not something that boosts anything. It's a replacement if you take it as testosterone, and it does have some effects. One of the most common reasons we see men for evaluation of infertility is that they have been taking testosterone, having no idea that the taking of testosterone will suppress, in general, their sperm function if they take it just as testosterone. So they're surprised by that, and often quite annoyed, because then it takes some time to get off of it, and they have to have all the side effects of getting off it and so forth, unless they do other things to support themselves through that.
Yeah, one of the things I, talked about in my research and in the book and my, follow-up books and people who come to see me clinically, is this whole idea of what does it mean to have low testosterone? And maybe you could talk a little bit more about that. Then I want to get into some of the other things that you address. But I found, and many clinicians know, and quite well, that what is often shared in the literature and even going to doctors about what does it mean to be low, how much is low, and how does that make sense in terms of different ages. So maybe talk a little bit about how you evaluate that for people who you may be seeing.
Yeah, it's not always straightforward. I think a lot of people, there's two errors I think that people make. One is that they are solely reliant on a blood test. You look at a number and they think that number, if it's below a certain value, it is low. If it's above a certain value, it's normal. And that's not right. It's not just that number. It's that number combined with symptoms that people have. But unfortunately, a lot of the symptoms of low testosterone are the symptoms of lots of other things. So if you were to ask, for example, I train residents, and if you were to ask any of my surgery residents, do you have fatigue and low energy? They say, oh, of course, I'm not sleeping all the time. So does that mean they have low testosterone? No. I mean, these are other things, and many things can cause the various symptoms of low testosterone, whether it's disturbed sleep or chronic stress or lack of exercise or being sedentary. There's just so many things that can cause it. So we want to look sort of at a big picture when we're thinking about low testosterone. So looking for symptoms that often go with low testosterone, and some are a little more specific than others, and also looking at the lab tests. And the lab tests are sort of notoriously hard to interpret, because you would hope, in the general sense of hormones, that you would have a value. If it's low, it means that you have some pathology. If it's a certain normal range, you're normal. Testosterone is really not like that, because there's a point that's probably natural for that individual person. And then what is low or not low depends on what that set point is for them, which is variable. So if you have a man who's let's say their natural testosterone is 600, and now they are at 300, a lab value may be reported as normal for that man, but they feel terrible because it's low for them. And it can go the other way. You can have a lab value that seems on the low side, and the guy feels normal. And so there's no reason to mess with that balance there. So we don't rely on a single blood test. We usually will get one blood test, then we'll get confirmation, and we'll look at other labs that are around that to see if we can get more information about why these values may or may not be off. And then, of course, we're looking at the clinical picture itself.
Exactly. So, talk a little bit about some of the other areas that people come to you and or come to, a urologist, or in your specific case, what people come to you. And as I understand, people come to you. You have expertise beyond the specific home area where you live and you practice. And so, describe a bit more about the kinds of issues that you see, and what are some of the broader men's health issues that you address.
Yeah, so it, I would divide this up into what's the more sort of standard stuff, and then I also have my practice is mainly a surgical practice, and so there's the surgical side of things.
Yeah,
But the most common thing that I'm seeing people for is erectile dysfunction. And that can be from a variety of causes. A big one are cancer survivors, prostate cancer, again, because it's common, is a big one. And a lot of erectile dysfunction may result from various treatments of prostate cancer. Um, Another one that we see very commonly is Peyronie's disease, which is quite interesting because it's not that rare. And for those who don't know what I'm talking about, Peyronie's disease is sort of an acquired scarring disorder where if there's scarring in certain parts of the penis, they can develop deformity or other issues that are quite psychologically devastating. And people are sort of stunned, but because again, men don't talk to men, and it's a little hard to advertise this sort of thing, they have no idea what's going on, but there are treatments for that as well. I also see it not really related to the testosterone and whatnot, but a lot of incontinence. So men who have trouble with urinary control, the majority of the patients I see for this are patients who have had treatment for prostate cancer.
yeah,
So those are many of the things. Another thing we see are men who they're they're interested in optimizing themselves, for lack of a better word. And I think that is true both from there's a surgical side of that, and then there's a medical side of that. And testosterone, of course, is very involved in that attempt for men to really be the best versions of themselves in an environment in which it is quite difficult to get good information that they can rely on. And sometimes in trying to optimize themselves, they do themselves some harm.
yeah. Well, I know you, like me, talk about sexual wellness as a kind of an emerging field, uh, as we want not only to treat problems, but to look more broadly at just how we can proactively, have a full, healthy, sexual life, physically, emotionally, relationally. Maybe you could talk a little bit about what your own perspective is on this kind of notion of sexual wellness, and how you see it, and how you advocate and promote it in the men that you see.
Yeah, I think sexual wellness is an evolving field for sure. And one thing that I really appreciate about that field is that I think men tend to pigeonhole it. They have an issue with their sexual function and they want to treat that thing, but they tend to think of it in isolation. And that's not how I think about it. And I think that's not how many clinicians think about it. Rather, sexual wellness is part of wellness. It can be a proxy for overall wellness. We often describe erectile dysfunction as a canary in a coal mine, or the tip of the iceberg, because it may be the thing that brings a man into a clinician's office, but it points to an underlying issue. So by far the most common cause of erectile dysfunction is cardiovascular issues. And so those cardiovascular issues, of course, are not specific to the penis. They are global issues within the man. They just recognize in the penis, but maybe that's the thing they notice now. And 5 years from now, if neglected, they have a heart attack or something, some other more catastrophic event. So when we evaluate men for erectile dysfunction, of course, we're interested in their function and we want to provide treatments for that. But we use it as an entry point to really emphasize the need for the fundamentals. And the fundamentals in all things are very key. So men who are sedentary should be exercising. Men who are smokers, we should stop that. Men with weight issues, they should hopefully work on that. Men who are not getting good nutrition, they can do things about that, and so on. And so we don't like men to come in and just think, I have a problem with my erection. I just want you to fix that, and I don't want to do anything else, because that's a band-aid at best. And so certainly, if I gave some totally outlandish stereotype, the guy comes in who hasn't exercised in 20 years and they've got a pack of cigarettes in their pocket and they've had 3 heart attacks and they want to work on their erectile dysfunction. Of course, we want to do that for them, but we don't want to do it in isolation. I think this is true for many medical conditions, but the sexual wellness is particularly interesting because it allows men to recognize the other things. Sexual wellness is not just a physical issue, but of course there's a significant mental component to it, both causative, chronic stress, and even anxiety about their function in the first place, but also their mental wellness as a result of it. Men have a lot wrapped up in their sexual wellness, their feelings of their own masculinity, their own self-esteem, and a lot of them don't feel whole when they can't perform or they don't feel right. And so there's that opportunity as well.
Yeah. Well, I just want to kind of piggyback on what you're saying about that experience that so many men have, that we're taught to be kind of lone rangers in a way, grew up with the stereotypes of, the cowboy and I think that's breaking down. I know I've been in a men's group myself now for 47 years, and I've helped, men, you know, connect with each other, because that's really, I think, a key part of wellness at all, is to break down the isolation that so many people feel, and men, I think, in particular. There have been numerous studies that have shown that the disconnection that we have from ourselves also is the disconnection we have from other men, and that affects our relationship with our families, our relationship with our lovers, our wives, our relationship in broad ways. So I'm wondering, beyond the kind of medically oriented focus that you have, uh, what are your thoughts about ways that we can get men more open to talking together, to be able to share, in the way that women have been trained and in many ways do more easily than men? My wife, Carlin, we've been together for 47 years now, and she says one of the reasons we've been together for 47 years, I've been in a men's group that's been meeting for more than 47 years, and that we've developed deep friendships together. And I'm wondering where that broader sense of men's community fits in with your own life, with your own practice, with your own ways that you understand and work with men.
Yeah, I mean, it comes back to this issue of communication. One thing that's a very simple thing is I always educate men about how often erectile dysfunction, for example, exists in society, American society. And there was a large epidemiologic study out of Massachusetts. This is an old study at this point, looking at the rates of erectile dysfunction over the years, and it's about 10% per decade of life. That's a bit of an exaggeration, but that's a good number to think of. So when men hear that 50% of men at 50 have lost some function and 60% of men at 60, they say, oh my gosh, this is actually a much more common issue than I realized. I thought it was just me. But I think one ray of hope that we have for this is that there has been increased communication. So if you remember when Viagra came out, which was the first really really good medication, and of course it evolved after that. It was good because it offered, some help to men. But what it also did was it helped communication. So some men were they didn't make the appointments; their wives did, their lovers did, and men finally felt more comfortable talking about it. We're certainly very far from openness about sexual issues, but I think that helps, that normalization. We still see a lot of it. I practice here in Utah, relatively conservative community, and some of our big insurers here do not cover anything that has to do with sexual function. If a man has had prostate cancer and has total erectile dysfunction, they will not cover, for example, a penile implant if that's what's required. And that to me is sort of a moral judgment, is saying, well, your knee matters, your heart matters, but your penis doesn't. The men don't think about it that way, of course. So I think we have a long way to go, but where I feel like this would be helpful is this slow normalization of things that maybe once upon a time were a little bit more taboo to discuss. And hopefully over time they will become less so. And there are examples of this. In For women, once upon a time it was taboo to talk about breast cancer. This was not something that was discussed freely. But then we have Susan Komen. We have now people very freely talk about these issues, which is great. And in doing so, that has allowed more awareness, that has allowed more research, just all the things that hopefully over time will lead to the betterment of these people's lives.
Yeah.
So I
Yeah, I've
think
had
that's a
a
lot.
just a fantasy that in some ways I think obviously men and women are connected in so many ways. I'm married, I have sons, I have daughters, I have grandsons, I mean, where there's this idea that men are over here and see men and women are over here. I've had this fantasy that someday we would have clinics where men and women would go in together often or separately, but would have opportunity, and women could be seen and talked about issues that they have, and the men could be seen, and then you could come back together and realize that we have things to learn from each other. Women can learn about things from men's health and vice versa. So I just, as we're getting towards the end of our time, maybe you could share a little bit about what your vision is of the future for men's health in particular, but relational health, as we recognize that we're
Yeah.
not isolated, that we're all in many ways in relationship.
Right. Well, for the men's specific health thing, I think that there's a lot of opportunity now. There would still many barriers to go, but while I mentioned earlier that it can be overwhelming for people to try to navigate what is it that allows them to optimize their health, I do think there is the opportunity, as clinicians from companies who are selling products to men, to be able to help them in both the education, but also help them hopefully find a way to do this in a way that is both safe and simple, and they get what they need. They don't get too much of what they think they need, and they get too much of it and then have other problems. So I don't think that is from lack of sophistication on men. I don't think they struggle for that reason. My patients tend to be quite sophisticated, and there's this phrase, do your own research, but it's hard to do your own research because that implies that you know where the data comes from, and that how reliable of a source is it, and what is the evidence. And I mean, this is something that takes a lot of training. That's why you went to medical school and did other things. And we can't expect people to really have that background. So I think we, meaning clinicians, we, industry, et cetera, can help these people by making sure that when we provide help, whether it's a product or whatever, that we've done so in a way that sort of advocates for them actually being healthy while never forgetting these fundamentals, because we do have a tendency, and American healthcare is unfortunately biased toward doing it this way, of band-aiding everything. We're a reactive healthcare system in general. And there has been movement toward being more proactive and less reactive. And I think, of course, that's great. That doesn't solve everything, but it does solve a lot of things. If you neglect the fundamentals, then these other things at best are band-aids.
Yeah.
Now, the relationship issue is a very interesting one. And some of that, I think, is just educating men that these are not isolated problems. I don't insist, but I do encourage men to come in with their partners, because they don't always have the same concerns and the same desires, but it is very helpful to see them together and how that interacts. What a man thinks that a man needs is not necessarily what the couple may benefit from.
Right.
And even though I'm not treating the women per se,
Yeah.
I do always mention the men like they are the patient, but really it's
Yeah.
the
You
whole
help one, you're going to help
picture.
the other.
Yeah, you have to, because just doing something in isolation. So an example would be if we see a man in isolation and we treat their erectile dysfunction. Now they have great erections, everything's good to go. And meanwhile, have not noticed that the woman has pain with intercourse or is having low libido, or then what have we really done? We have the guy here, we have the woman here, and there's this total mismatch, and that's not going to be very helpful for
Yeah.
either.
Well, you mentioned when we talked earlier that you have a website, and maybe you could let us know what that is and how people can learn more about the issues that were talked about, or the
It's
work
funny
that
you
you're
say
doing.
that. I have to actually look up my own website. You'd think I would know what it is off the top of my head, but I actually don't. I let's see. I think it is men's health. It's embarrassing that I don't know it. Um,
Well, you can let
oh,
us
I
know
did get
because
it. Okay, here we go.
yeah.
Men's Sexual Health Utah.com. That's one word. Men's Sexual
Okay, super.
Health.com.
menssexualhealthutah.com.
Yeah, it's so embarrassing. I don't know that.
All right. Well,
Well, and we we use that website primarily not really to get patients, but as an educational thing. We think
yeah.
there's good information on there. We spent some time trying to make sure that we have information so people can get what is information that we consider useful. I think that there's a lot of information out there. This is one of the issues with the internet, right? There's
Right.
everything on there. Some of it's useful, some of it is garbage, and it is
Exactly.
very difficult to sift through it and to get a sense. And I do hope that over time, we in society get sophisticated enough to be able to weed out what is helpful and what is not. That's a difficult lift.
Well, thank you. I really appreciated our time together. Maybe we can stay in touch as things
Thank you.
evolve in the field, and appreciate you being with us today. So thank you, Doctor.
Thank you. Thank you so much. Really appreciate you inviting me on here.
Sure. Take care.
Thanks, you too.